Okay, on a kusha on a kabo, on a welcome to the Well Body Better Pass Gently program. When a salon people don't learn boku book na they bring this program to na. Me not to one part more. Me na business IT consultant. Na me name Timu John Fuller. Okay, in IT as I be cybersecurity na me know. The only reason we make a dinner for help them book my so for the book and to uninterrupted. So they will present to. Okay. Today we deal with monkeypox. We now they call her M-POX, obviously for political correctness. So now they call her monkeypox anymore, they call her M-POX. I guess I believe that's the reason. But if I'm wrong, the doctors then will correct me. And today, the 79th session, what we do today, on Sunday, the 29th of September, 2024, and a Dr. MSI Kamara in the main presenter. However, we get the Well Body Better Pass Gentry team. We go there at the back for support them. I understand today, Auntie Nafisa to Sumare will present as well as part of this presentation, and also Dr. MZ Toure himself will present. I'm not going to talk about them because I don't talk about their qualification and what they do. I will left them when they begin present. We like in a few seconds, they will tell now that they be. Like I say, the Well Body Better Pass Gentry panel, they will have the panel for answer any questions when I get. As long as not to personal question, we need medical records for the way we advise, but that's until we a general question you ask, the panel are knowledgeable and experienced enough for them to provide one. Okay. We present this program, we know they get paid, we do our normal out of the goodness of we heart for we try for help people in our salon. Why many people in a salon? I don't just mean nobody in a salon, but people in a Sierra Leonean, regardless of society. It is what make we do not to say we underestimate people and see them, or if they talk to them in English and they understand. But sometimes the way you get boku war in a then and go tell you bad news, sometimes you not go able to comprehend things. But yeah, a safe space for you ask them question in there, and we will give you advice as to if you see something when you for seek help, and when you for seek help. The way you go seek help, what are the kind of question them for ask? What are the thing them for look for, then kind of thing in there, and how you be able to man yourself as well. So there's some skills that they okay one go hospital for that thing they okay book on house. But also sometimes the reason we make certain thing can happen to because of we don't understand. They can put yourself in harm's way. By the time they realize what they happen, they don't too late. Okay. So like I say, we know they get paid. We do one out of the goodness of hearts. What do they ask as well is if anybody there in the audience, or we know somebody in high places where you made this program reach with people and through radio or TV, please get in touch. However, people that we don't get in touch in the past, unfortunately, we not prepare for pay because at the moment we didn't get any funding, and we do a lot of things already as part of we own pocket. So for say for no pay again, like go there on TV for we people and we will give free advice. With this, if you go for go see your doctor, you pay for them give you advice. But we they give for free. So if anybody prepare for doing for free, we they give the material for free, let them go do whatever they make out of them, concern with. If they will make donation, that's fine. We'll not go say we return down donation, okay? But if anybody get the opportunity for get this on radio TV, welcome. Now, they say the recorded material go there on YouTube, Facebook, and also we get a WhatsApp channel. And the number down there, I will share the group link later. We get a WhatsApp group. The group not to follow everybody they post, so the people can begin post about immigration and marketing and whatever like that. But the doctors then are the only people when are the people they will share. And then they share information that we get to do with medical issues in the world. So we self will be informed, as in waiting for do advice and stuff. Okay. As I said before, for we were brave enough for then a camera and talk. If you want to ask question, most of them are this kind view and I go see. If you don't change at some point, I go, somebody can point them out to me, say the screen don't change. As far as me, you not change it. So if you look at this three button here, if you press them, you will see this. If you want chat to me, you can send me a message. You can give thumbs up, you can like, But if you want to ask question as well, you can use that in there for raise your hand. This one, use them, raise your hand. Where I see them, I will come to you. But for we maybe with the analog still, not digital yet, we not understand all the NTR or unable the faffing, or maybe gadgets not good enough. Whatever the reason, just put your hand up. If you come here, the one I will see you when I see you. If I don't see you quickly and I beg not to say I ignore you. But once I see you, I will come to you for the ask a question. Okay. Without further ado, I think I don't talk about cool. Thank you very much for not joining today. However, if anybody feels say he can do better than me, or if you say there's a certain topic there where we for discuss, or maybe even one volunteer in your time, or can present or for help with anything, please feel free for get in touch with me at this email or contact me on WhatsApp. Okay. Tell me what you want, whatever it is, that the feedback. In few weeks' time, by God power, the website go the up on us we will talk on us waiting for do and how for do. I know we don't promise few weeks ago, but there's certain things that they will work on the background. By God power, we'll get them up and running soon. We will be able to go on the website to see all the past program that will be done do. And I'll go there, have a look, volunteer or make comments and stuff like that. Okay. But I thank you, plenty, thank you. And I thank you very much. At the end of one now to Dr. Kamara, we will take on through this session today. Dr. Kamara.
Right. Thank you so much, TM, for that intro. I'm Leonardo. TM, you want to enable me?
Yeah? You will make me admit, or you hand over all to
no, yeah, that's right.
Hold on. That's what I'm about.
Yeah, that's right.
There you go. Sorted. I will make the other parties them and co-host as well. You good?
Okay. Super. Leonardo, thank you for want to join me. And today we talk about M-POX. Now, we've been not talk about this before. So this time we decide say what we do, we talk about from different angle them. I get me in them, colleague them, then go help me pan this talk. So when you reach to their own turn for talk, you're gonna go see them definitely. So me, they make a start, and then we go carry on from that. As I can see, the title that multidisciplinary approach, which means not to me one grade, not different people in the talk. So basic way we talk about as I can see, the very first time, late in the 1950s, they able for pen this sick. So this sick been on the long term, but nobody know about him. And of course, now this is the first time we they see him. They find them from monkey them. They, what they call Cynomolgus monkey, whose country in Denmark. And then later on, a few years later, you find out say Congo. The Democratic Republic of Congo, they find them there, and when they find them there, they mistake or confuse chickenpox for this M-POX. Now, we're not going to know why. We're not going to see later on, And so later on, then you get another outbreak. When I say outbreaks, the thing go only one particular place, then sometimes they move from there, go to the other side, or the same place, one be done there, done better, and then the other one obviously grab again, like how we been get them 2022. So as we can see, 1970, like the first thing that we then find per mortal man. So after that now, we see up to this particular time we talk so now, Bosnia, Nigeria, Bosnia, America, and then 2022, the whole world we know about this thing because it become an emergency. More than 60,000 people them being casually sick, and out of them over 100 people them we die as well. And inside UK, England, yeah, we get over 3,000 them we be casually sick. So the good thing though, well, I don't know if you could call it a good thing, is that if they kill people them, but the other way you expect for die from that thing at 10%. So if you get 100 people them, 10 go likely die, but no means that then go die, but now up to 10% and then get, So waiting at this sick M-POX, now they call them monkeypox, but because of the stigma, because of the problem them, we then find like for example, this sick then catch them or they see them mainly the people the way they sleep with them company man. So man where they sleep with man, and the gay want them and the bisexual want them. The way they go with man and woman them, and so they make them call them GBMSM. And they name that. So GBMSM, which means gay, bisexual, man where they sleep with company man. Now them been the get them, but that not mean say person when they sleep with in company man, we not to get no they get them all. Because we way they work with them, we way they treat them, we say likely forget them if we're not careful. So that's the thing about it. And a virus, 90 cause up. Just like how COVID been doing a virus, just like HIV in a virus, just like Ebola in a virus. So then get two types. Then come up from this family, orthopoxvirus, that's what they call them. Then get clade 1, we get two subtitle, if you call it sub-virus them. You get one when clade 1A, and you get the other one clade 1B. So now 2, then they're under the clade 1. Clade 2, then get 2A and 2B. So 2022, when 2 years ago, when this thing begin, where we all been afraid, now because of clade 2B. This one now, a different one, we're going to find out as we go on. You know, again, na Congo, now in this thing begin, but mainly na Congo, you will see clade 1A and 1B. And as it happens, because the world not been prepared for them, vaccine not been there for them, and so therefore the only vaccine we can go use, we're closest to them, now the smallpox vaccine. We're very similar to this sick. So now the smallpox vaccine they use, but they get other viral, antiviral treatment, they wouldn't give tablet and just for maintain. But for say treatment like that, now we talk about the vaccine. So this just they show now almost say the world not prepared for them can't tell we can bust power. Yeah. So the way this thing they transmit, as you know, now through close contact with person we get the sick, or through the animal, or sometimes when you eat the meat and things like that, we will see all that there. Of course, the people away they high at risk, now people away the defense, i.e. what they call immune system, not that strong. Like if they pambele, they expect, or sometimes you get chronic sick, or sometimes you get cancer, or sometimes they take treatment for cancer, or sometimes you get HIV. Now make you see anybody we then see this sick man, then go test them for HIV and the other sexually transmitted diseases as well. You see, so mainly the treatment now one way now just they manage the symptoms. We don't call supportive treatment. So if somebody get pain, you manage the pain. If you say the blister, don't they get pus, and then the boss, it turn wound, the person they get infected, then of course not forgive them antibiotics because the virus they hit the immune system, and so any way the body be able to cope with, it for cope again. So now you get superimposed infection, that's what they call them. You know, and so therefore it need to be treated. So bring the temperature down, control the pain, and then nutrition, and give them enough fluids for drink, and look after the skin, and then make sure say you not get complications from there. So this nine, as I say, nine just they tell you with this thing. This virus, na DNA virus, you get 2-strand, double-strand panel. The reservoir where people then think where they know where they study, and they say now from monkey, from squirrel, from arata them, people they will look for eat that bush meat. Now they then can come out, you know. And so then go pass on to themselves. Nobody not get nothing for do that. The moment you go get involved on them, now they this thinking come out. So the thing they carry them, the vector, they're not able to prove identity, they will never know. But when you contract them, you can get them through when somebody cough or sneeze or sing, or you touch possibly get them, you know, we not cover the wound them. Then continue. So definitely, if you get them, it will affect the throat and all the other part of the body we are going to talk about. Then you get the term from where you contract them to the term where you begin feel the symptoms. They range between 5 and 21 days, but average now 10 to 12 days. So within 2 weeks, when you come in contact with them, now you will begin feel within that thing. So as I say again, the treatment not just supportive, and the picking their own treatment is not different from the big one. Their own treatment are the same thing, and the vaccine them, as I say, now smallpox, and then now we talk about and the vaccine when M-POX vaccine. Now, as I say again, between 2 to 4 weeks, then croco business identity fever croco well, up to 6 weeks, then go down well, even if you not treat her. But for that to happen, the immune system got to be really strong. Now, the problem here is you can't know, because if your immune system weak, then you take and say you go well for yourself, well, until you expose yourself to danger. Now, the problem that. So that is very important for when this thing begin, if finally you get seen straight away by the people in West Sabi to do. So 2022, as we talk, 9 this thing broke out now, yeah. So now clade 1, 9 being broke out in 2022. 9 na Sudan they come out. So from 2022 to now, obviously the thing then don't go up, and the other place where it been really bad when I didn't go say they most of the time like Ebola, na Congo, Democratic Republic of Congo. And that place they then get clade 1 and 1B. And by 2024 now, then, of course, this thing now begins scatter. To the point now, we get in 120 countries in the world. When they do the test, them over 100,000 confirmed cases from the laboratories, they lab them. And then amongst them, 220 people will die. So more or less, 1 out of every 10, and like that. In Africa, as of this September, we did also now, we get over 24,000 cases, including 600 people who don't die so far. So we get one case as alone where, as I say, when they test, they say not to so, not to this thing, but we don't know, and they're not confirmed. The problem now is some Monday you get the sick, but the test negative, but you get the sick, and some Monday you not get the sick, but it test positive. But then the way you go medical school, then go know about that. If you don't know about that, when you get the sick, now for try go get tested, and that's it. And it no matter if they begin treat you, but then they find out, say later on, you don't get out. That's not a problem. Yeah. Burundi, himself don't pick up this thing a lot. And then Sweden, in August 9, then they document the first case, when an imported case. That means not today the case begin. Now bring and come from the country. Somebody will travel from the country and bring and come to Sweden. So again, in the UK, well, they don't report up to 286 from last year to this year. So this one just they tell you no more how this thing they scatter from USAID very high to USAID moderate and USAID low. And you can see all over the world now, so they pocket no more than scatter. Now I like this slide because they tell you exactly USAID the cases in Boku. May not be even know say America get cases past all side. But as you can see, USAID that dark blue, that navy they at the highest, they get over tens of thousands at the end of the day. So North and South America, they definitely get, as when I go see later on. Africa, you go see green, then they 10 to 99, and then the one the way white, now them not get no cases so far. But again, this now waiting, they say in June. Now we did September the end, sometimes something else could happen. We'll not get the latest data, but like this now we get so far. As when I can see, at Congo, in South Africa, now 3,009 they don't detect so far. And then in Europe, now France, they get over 4,000. And then, of course, you get Spain, you can see 8,000. In the UK, why they talk themselves now 4,000. Then, surprise, I say Brazil, we have been talking about South America, look at 11,000. And then, of course, America, 33,000. So, day and in widespread, may not be able to think, say, America will get that, but there you go. You see. So, this slide just to tell you now more how this thing, again, as we talk, 10%, up to 10% can die if they not treat them, how to treat them. The way they cause them now the M-POX virus, and a double-stranded DNA, as we talk already. This outbreak, the first one we know about now 2022, now been the 2B, now being caused. But now the 1B, now we know say we detect beyond Africa. You see, natural reservoirs, we say squirrels, monkey, arata, and the other thing that they. See, now, we did not say nothing as alone, but look at this. This picture, they tell you, say, it is alone, Liberia, Ivory Coast, Ghana, and we don't see Togo, but then you see Nigeria, Cameroon. And if you see inside the blue day, the right hand there, we get Congo, Central Africa, Gabon, and all that, then you know the clade 1. Now they most of the time. We didn't say endemic, it did all the time. And clade 2, it did for we in West Africa. So Central Africa, now more clade 1. West Africa, now more clade 2. Now in the course that you can see. So you can see, say, clade 1 and clade 2 then get different, rates of death. How the people in the die. 10% will die from clade 1, whereas more than 99% of people will survive with the clade 2. Way now we get now West Africa. So perhaps sometimes because people die of that, they feel say they did. But as you can see from that is the World Health Organization and they tell we know say they did. So this slide I like because what they tell you exactly how this thing they transfer from one person to another. If you watch, you can see the one at the left, you can see how mama they pass on to in Pekin. So you can pass on to in Pekin, obviously where they born, when a vertical transfer or transmission, if you like. And then of course the mommy, when you get them, you can pass on through the breast milk, and of course the Pekin them, if they're premature, they're more likely for contractor for ketchum than the one way in a full-term baby. You see, and then of course the other way they miscarry, or the other way they go poil belly, then you can risk the chance because when you get belly, the immune system not as strong as the day when you not get belly. And then, of course, if the pikin unfortunately die when he did na mama in belly, we then call stillbirth. So all that they can make the pikin them prone for let them catch the sick. Now, if you watch from animal to human, I make a between and say when then they pass on to the self, animal to animal, we don't know nothing about that until we go get involved with them. So if you eat the beef, you know, whether be it na chicken or na meat or whatever, or if you they handle the animal, like so tell you they breed the animal get them, it can pass on to you like that. Or if you do close contact with the animal, we get them, or even the person we sick, you can get them from that. And like from we now, the human beings, human to human, or you know, from human and animals, you go see, say coughing, when you cough, you sneeze, person they near you. Of course, if the wound then the wound they discharge and they pan the linen or the bedsheet where they don't pan the person they go care for you. If you're not careful for treat the thing, as if for do them with gloves and then put them straight away into the bin bag. Way this in a red one way, just they put them with the bin bag in the washing machine at 90 degrees. Sometimes then they go catch them. The unfortunate thing is, you possibly say you're not going to say you don't catch this thing until maybe up to 2-3 weeks, and now that's not the problem. So as you can see, if you use the cutlery, the plate and fork and spoon and knife, way the person will get them, you know, get this thing in mouth, and then you self use the person to say go catch them, and you can see say they close them as well. Then the last one, this one where you see they put man and woman. Well, we don't say no to just man and woman, man and man, and woman and woman, woman and man. There you go. Then self can catch that in there, obviously, because most of the cases them are from down there, 9 then catch them. Oh, I don't talk about the animal to animal, as you can see no more. You see the bush meat them, you know, monkey to a ratter to squirrel, and so they go round and round. And then from there, animal to human, as you can see, obviously horizontal transmission, that's what they call it. So they come out from one person to the other, and you can see the belly woman them, then obviously they're more at risk, and they can actually they're at risk for passing to the picking, whether they're born, whether they labor. So that's the other thing. So the slide bottom when at the B1, you see say it show you all the part them where this thing can affect. If it affect the brain, it can cause the person for face you get that meningitis where we're all afraid. You know, and then they can cause headache, the person drowsy, you know, they feel well, you get temperature, it can affect the eye, you get conjunctivitis, the eye, that Apollo, where the person can get. Then of course it can affect the mouth, where you affect the person for eat, and then of course for swallow. Then itself can come because and then the nine more there. So if you use in your utensils and then you go use them, you likely forget you. It can affect the throat, like how we say earlier on, say it can cause this pharyngitis, laryngitis. It can affect the muscle them. Now, one of the things that we can force feel the muscle them begin at you, just like how they get flu. Again, the muscle them and as well they joint them, then self the art, you know. And then of course inside the gut, believe it or not, we get this defense system where they win the lymphatic system. Now, they actually help you for mop up all the poison and things like that. So if you affect them, it can affect the gut and the belly, and that can cause problem. Of course, the skin, we know say the rash there where you could get for seed later on. And then it can affect the organ then we call you man and woman. It can affect that there as well. Now make it can very difficult for you for diagnosis if you don't get the blood and we then get that sample within they send at the lab for let them actually detect that we then call that PCR, polymerase chain reaction. Now no more specifically for them. If you go check and you get the blood, you go get the thing positive. It's possible to say now other sick you will get, we're very similar, but not the same family then come out. Remember, you know, to 1 grain virus. So if you go, now the only thing that will detect. So you can see, if it affect the heart, it was what they call myocarditis, then itself can kill. Or the cover within the heart, what they call myocardium, can get, you know, pericarditis, then itself can kill because it could squeeze the heart and then cause problems. Then, of course, if the blister bursts and it turn wound, then it gets infection. It can give rise to sepsis. And sepsis now we know it's a kill. So now dangerous sick, whichever way you look at them, you know. And then if you look at the right hand bottom, you can see what they use for treat. As I say, supportive treatment, and get this teco Virimat, in a tablet, and then get the other antivirals within they use for actually help. Then call brincidovir, we then get as well for app for the treatment, but no specific one no day. So this one just to tell you about the signs and the symptoms. So if somebody come out na the place where he day say for example, you come out West Africa, or you come out Burundi or Rwanda, or come out Uganda, come out all them countries, then they like Congo, where Gabon, when I did this thing really, they boku one, and it came up to 121 days after, he began complaining of this fever. He throat the atom, he get this rash, or he get a headache, or the muscle in the heart, the bone in the heart, the back the heart, you know, get energy, just they feel weak and all that. Then of course, now the groin or now the armpit, you see then lymph nodes here, the swelling, they wouldn't can say somebody get groin and all that. You see that then somebody cutting foot, that's alone, the thing swell now the groin, now all part of that, now the lymph nodes there, the lymphatic system now in the work. So that now part of the thing we can cause the person or begin determine, say, I know well, we'll make her go hospital. And the sooner you go hospital, the better it is. But then symptoms here can last up to 4 weeks, maybe longer in the person way in your own defense system, know they work. So this again, just they tell you no more how this thing they begin. If you watch the bottom, you will see incubation period. Then at the time where you catch the sick to the time where you will begin to see the symptoms, you know, between 5 and 21 days. And then when this thing come, you will see the symptoms that you will begin feel force. Like you see, the rash they come out, small one, no more like that. And then the throat, the temperature, and then the swelling at the armpit or at the groin, and then the muscle and the heart, the bone and the heart. Then the rash begin go. And they begin scatter now, they go at the chest, at the back, and at the eye, you know, and all over. Then, of course, when that happened, you'd expect, say, between 2 to 4 weeks, now in this thing go well. By the 6 weeks, the rash go down well, it will left some scar then, but at least you go down well. But obviously, you see two conclusions there. One, if it is well for himself food at the top, and the bottom, you go see, say, the person can be so bad that sometimes it can lead to death. That naive complication there. So, to see go for play with. I like this slide because waiting do, if you watch them, they make them like say, na trophy, but waiting they show you here, now how the rash, who they talk about today, now the black man, i.e. the black person, the person with light dark skinned, and the person with light skin at the bottom. So you will see I'm say it's a good slide because they give you the difference between how the rash look on the black man and how it look on the white man. And you can see I'm here, so in the begin, yeah. You see it's so flat. Then this now so it look now up and we. Then and the weight person so it look like. And after that now you go begin grow it turn blister. You see so now the black man now so now the white man now, yeah. Then now they develop into papules. Then papules then they get the liquid inside what they call vesicles. From that vesicle they now, this thing they gather, the bacteria go join them and then it become it get postpartum, that tough. This tough now, and they make this thing the boss, it give you this wound. This wound now, that's why they look like a black man, and that's why they look like a white man. Now, to 4 weeks or so to 6 weeks, you go well, that's why they look like the white man, the scar, and the black man, that's why they look like. So a good slide is where they show you exactly how things they happen. As I say, all the other things that I don't talk about, you see them yonder, you know, the rash, the pain, the back passage. If it affect the gut, it can cause abscess in the gut, we go make then get for operate by you. Then it can bust the gut, you know, perforation, as they say. If it affect the brain, you can get encephalitis, we need for be treated immediately because it can cause problems. If it affect the throat, you can get epiglottitis, instead of need proper treatment by the specialist, the ear, nose, and throat. Myocardium, obviously, now the cardiologist then can do that. So, na sick way, they affect boku organ in the body. This one just they show no more how the rash they person with light skin, person with dark skin. In the area them way the skin there. And you can see someone can get them so bad, it can frightening for look at, you know. But there you go. Now the kind of so then the different one from different parts of the body, the nose, the face, the behavior, the hand them, the foot them, the leg them. This one good because it show you how this rash when it begin and how it they end, as you can see. So within 24 hours, you can see I'm not so you go down, you know, and then after like 6 days, you will see 96 hours now. So you know, yeah. So like you know, 3-4 days now, so you go turn. I tell you, they get to 6 days, you don't get the postpartum. I'm now tough. Then they bust now, turn this wound. Then this wound now in the heal, where you heal, that's where they left. That's where they turn, you see. So it just shows no more. You see, it's the same thing now. Yeah. It begin and then it turn pulse. And then if you didn't have the finger, that's where it turn. If you didn't have the palm, that's where it turn. It just go for sure now. No more. Say that thing really scary. But it confuse people and because Bokuma no know how to distinguish, how to differentiate between one sick or the other. You see, one thing you get to know is that this is the public health advice that when person get this thing, especially like chickenpox, like you see we picking get chickenpox, if the thing don't begin blister, if not for take this picking go school at all until then cross their don't begin heal, then don't begin well before the picking go back to school. They can take around 3 to 5 days for let that thing they happen. You know, to that it go just pass into incompetent. However, for picking, not bad, but for adult, for kid chickenpox, we not be non get away, baby. Now big problem. It's really difficult for treat when it become adult, you know. And then of course, you have to understand, say some people and they're not going to even get the symptoms at all because we think the amount of the virus will go pandemic less, so the body cope with them. But some people and they will definitely not go do that, and so therefore the end and then they're supposed to be treated. So although people in Kinde they not get the symptoms, but we don't know how much the percentage of them people and the way they're around. But you see, as we talk, they are the way now picking them, now mama them, now people the way they expect baby, they are the way sick, HIV, then get cancer, or then they go undergo treatment for cancer and all that, then definitely more at risk. Again, this bottom bit just to tell you now, which we don't talk about already, all the different organs, the way they affect and how you go and bug you. So now I go pass over the mic to my able colleague, Dr. Toure, for making take on through the other part where the epona for distinguish, for differentiate between one sick or the other, because the rash is so feeble, boku sick, that you get way for distinguish one from the other. But Ingo tell you about that. So over to Dr. Toure.
Okay, thank you so much, Dr. Kamara. Thank you all for listening. So, like how Dr. Kamara don't say, this sick here mixed with so many other sicks, they hard for you differentiate them. They'll say even the most experienced person sometimes a heartfully you gonna know say this and that. So we bring this one so that people are gonna know say if you get this, somebody get this a lump in body or get rash in body, you know, straight away begin stigmatize them or begin rush into and say, oh, na M-POX you don't get or na other bad sick you don't get. So can you give me the next slide? Now we see the difference. So now we see this, the cow Dr. Kamara say, chickenpox na one common thing where they can mistake with M-POX. Because then two, they get this blisters, this a lump they in the pool. The lump then gets fluid inside. Now, if you can see this picture, the second picture, you see how the papules don't form, you know, and then you don't get vesicle, you don't get some fluid inside the like how Dr. Kamara be describing. So now with chickenpox, this na clear fluid the inside, and it very itchy with chickenpox. And then, of course, they start with the trunk, you know, and go na the extremities and spread elsewhere. As opposed to M-POX, it not only gets fluid inside, clear fluid, it get pus or tuff inside. So now one big thing that we see. If you see M-POX picture, they see say it gets tough inside Panam, right? And this chickenpox, we picking it, they get and chickenpox mostly now picking it, they get out there young, and as they go or as when it don't heal off the chickenpox, it not they go completely because a virus, it is staying at the nerves. And later on in life, if person immune drop, it develop what they call shingles, you know, zoster. Like you see this pic here with the eye, up, it don't get this distribution of a nerve, you know, happy zoster, ophthalmicus, then column, now they it don't affect. And then this possibly they don't with in back now the same chickenpox again, or the adult one they call happy zoster, now in get these blisters them where they develop so. But this one now I they develop, it is now only one pattern because it follow what we call the dermatome or the nerve distribution, how the nerve day. So now they see this. Now, if people like remember in a salon, when somebody get this, then they say now will show you get. So not to actually will show now happy zoster now you actually get. Now, the other one we common, we similar to a smallpox. You see, they're all getting small rash there. And because they're so similar in distribution and everything, make then they even use the smallpox vaccine and then they use for treat the Mpox. The Mpox and they start inside the mouth, then sometimes it's spread at the face and other area. Then let's go to the next slide. Now this show this example of, you see how Mpox day we don't reach a stage now where the pus don't come or don't dry. See this man in lip how it look like na Mpox. And when somebody gets one condition, one bacteria infection, then called syphilis, yeah, Treponema pallidum, they call them. The spirochetes, the bug of itself, where they enter the skin, any pattern of the skin where they enter, it cause localized infection there or ulcer inside there. So this pus here, unfortunately, now to a mouth, now they come. So they see in lip, they get this ulcer here. And they see, if you look at it, you see, it get that ulcer in lip. Some man did so this in tongue. Some man can get an in lip. So we can go similar to Mpox as well. So the site where they enter, then the primary syphilis, at the first site of entry, then called chancre. Now, this wire, it can happen not only in the mouth, it can also happen in the private area. So if you get ulcer or so foot or wound in private area, we're not painful, it's painless. Like this one is very painless. You get other one they were painful, you know. But this one in painless. You get ulcer the area then they. You get for see your doctor, let them examine it, let them see, do test and see if not to syphilis you get. It can get anywhere. The first side where they infect you, now that ulcer they form. If it can go on you, if they not treat you at all, it can end up for being what they call secondary syphilis, where they affect you, they go now the whole trunk, the chest, the back, the hands them, now the palms them. You see how it spread all over, just like with them. But this one they all have small, and lumps them. You see, as opposed to Mpox, you see the picture, they will be sealed and be very, very big. Now, then are the syphilis. Then you get the other one, somebody get gonorrhea. If you get gonorrhea, it affects the skin sometimes. It see instead getting kind like this bottom left hand where they see this posture and gonorrhea gets, so it don't affect your hand. You see, and this player or then get measles. Of course, measles they flat and it starts from the face, then spread right throughout the body. So measles self can get rash where they develop everywhere. So that shows, say, the rash they happen at Mpox, you get other condition in the back could then get rash them as well. So if we go to the next slide, we see scabies. This one are some kind bug or parasite or so where they affect the person. It cause extreme itch. It scratch your body from head to toe. It come through mostly between your finger then. Now they can enter or sometimes by your skin. If that scabies don't become infected, you see this person at the top right, this white person here, now so they develop pus under them. Where some if here, you go and mistake and like say na Mpox, you don't get because you get pus, but this is not infected scabies. Also, it's down at the bottom slide there. This pus here where they see it gets, yes, this one they call it impetigo. This is a bacterial infection where can happen because the skin gets bugs them as well. You know, Staphylococcus aureus, staph epidermidis, then staph then they or pyogenes, then staph infection, and they can go by a broken skin. It can go inside and it could cause infection. You get two types. You get one we they call the bullous type, and you get the non-bullous type. The bullous type they produce some kind toxin where they separate the layer of the skin, and sometimes they cause pus, they cause fluids they develop inside there, like if you see down here. And when it release the fluid, it later on form a crust, and the crust the fiber like golden something, like you see the nose of this wire where them golden things and the panel. So now, so yes, it appear, you see, and it can happen again at the person foot. Like you see that, so you see an ulcer and I know happen at the person in foot. So this one now impetigo. This you need bacterial antibiotics. This one you need antibiotics. Like that picking the way they so it depend all over. You see, so then they antibiotics. So each of them, they get their own different way where they treat them. So this is not just some of the few, but you got so many other ones, and they will, if we will take a whole day for long, we'll talk about the whole night. So this is not some of the few for let people are aware, say, different condition in they will present with different similar rash to Mpox. So let's not just rush into them. So come to the next slide. We try to get the advice where we need now. If you they in the UK or so, you get Mpox, or you suspect say you get Mpox, or you don't travel. Now, then country the way Dr. Kamara they talk about within the last 3 weeks, and you don't notice any lump or any rash or any ulcer or any wound or anywhere, you call 111. Right? And 111 will advise you waiting for do. You get for telling see you don't travel na then side and day. And also, then they advise you say let you stay in a house. Try not forget any contact with anybody within near you. Stay at least a meter away from them. No share bedding, no share towel, no share nothing with them people in there, because if na Mpox you get, for let you transmit that day, it's very easy. It's transmittable from the time when the person gets the Mpox until then scabs then they like how Dr. Mohamed describe them, until they don't dry off, then fall off, and new skin be developed under them. Now that thing they maybe it'll be less effective. Okay, and so if somebody touch yourself, it gave for spreader. So I make them they say stay in a house, try for dinner. Difference. Of course, we don't come on under COVID. We know how people in the isolate. Now, if say you don't get, like man, they get sex with incompetent man, gay or a bisexual people, or you not to bisexual, you deal with you person, but the person we deal with, they don't travel go na then side and day, you can contact the sexual health center within nearby to you. If the sexual health center will able for the advice you waiting for do. Again, when you they isolate, you they self-isolate, like how we don't describe, the only time where they make you end this isolation, yeah. Now where a B say then go advise you, so okay, stop isolation, but the clue as to waiting will make you end your isolation. Now, one, you not get no fever at all for the next for at least 3 days, no fever at all. And you know get no new lump or bump in your body. You look head to toe, you know get no new one. And all the lesion, they all don't dry, they don't fall off, and new skin don't begin build up underneath. Right? And you looking at your mouth, you know get no wound there at all. Now that 10 day, I shall say yes, you can able for come out of isolation. But now, if you want to resume sexual activity with your partner, the advice say now for use protection first, at least for the next 12 weeks rather, for 3 months, if we use protection, because we don't know how long this steer the day inside the semen or inside the blood or anything. So if you can get them the tendency, they say you will transmit them to the person, or the peculiar will get it will affect things them. So that makes them get them self-isolation, them advice them there. If you think say you get them, you call them again, they say, okay, your condition not too bad enough for going to hospital, or you just get them, but you don't get other symptoms there, they can vaccinate you. Then we don't stop the vaccine, the rapid vaccination last year in July 2023, but you still get centers where they open. Centers they in London and Manchester now, centers they open. So you can go na your NHS website. This is not the link below there, where you can type your postcode or your area, then you see the nearby place where you go for get this vaccine. Now, for people in a salon, we notice that there is a case where they began before. In that case, they I think say they contact the rapid response team and all that thing, and they will not be able to talk much on how then they deal with it, but I think say there must be a rapid response team we will contact. So I think so far, I think that advice they will be useful to everybody. Thank you.
Thank you so much. Dr. That was really kind of you and very kind and very comprehensive. Now, again, this one, I don't want for repeat waiting Dr. Toure don't talk. Again, we see the differential of diagnosis where you don't get. You get smallpox, you get chickenpox, you get measles, you get the skin infection that we talk about, procro, herpes, or the early about syphilis, and other sexually transmitted diseases, as well as medication. And some tablet and the way they take, it will make your body begin not only crash, but it will begin like the body they peel, they peel, and then obviously then they can cause that misconception or misunderstanding. Say, nah, then they don't get. But if you go to the appropriate rate for DUAM, you go see, say, definitely that then go for do the test them, and then of course then go for treat you accordingly. One thing the more point on this thing, they just show you, if you see the chickenpox now, yeah, very, very difficult for let somebody die of chickenpox. Now with smallpox now, it's so dangerous that up to 50%, so half of the people and the picking the way they suffer with that, they likely forget problems, they can die. Don't necessarily say 50%, but to 50%. And then of course this sick now we talk about now 10%. So you can see that they can even make you differentiate one from the other. If you watch the one way, if you get a no more 3 days as you get them, you go come na measles. If you watch here with the monkeypox or M-POX, now up to 21 days. With smallpox, now 19 days, and with chickenpox, now 21 days again. So you can see, boy, even at 10, whereas this one at 5 to 21. So you not only for know this, but obviously people that we know about and then go actually do all the test them and then go know waiting for do. So this is not just how for diagnose them. If you go like where you go, not only for know this, but you find for the medic the way they on board for make them ready. If you they test, please no go use that blood test for say you they test for this. If you do then you can come up with the wrong result, and then that can cause problem. So therefore, the thing we would look for now this PCR what I've been talking about, polymerase chain reaction with DNA one. Now that go make if it come positive from the swab them, like where you put that tissue that goes, you rub and tranga one pound inside the crocodile, inside don't boss, then you take and put them. So man goes in at the mouth, some man goes in at the throat, some man goes in at the back passage. Then they can go in a special media, special container within they can go immediately then pull up. Because not for delay, then send and go directly for them to go test that. Because sometimes if you delay, you can actually make them not as effective as possible. So you can miss the diagnosis by that. But please, no do a blood test because that did not go give you the right answer. And of course, no look for antibody because when the thing they go inside the body, then call them antigen. When you reach inside the body they respond, they produce this antibody, and then you get this antigen-antibody complex. When that, then they look for. But if you look for that, it will be difficult for make you able to distinguish this M-POX from the other one because they're the same thing. They come with all of them. And of course, we know say then definitely they offer HIV testing to all of the people that we don't test positive for M-POX, even the picking themselves. Yeah, so that's the thing. We'll just talk about the treatment, and as it were, because the M-POX mild, you know that stronger, and you can get, people working well within 4 to 6 weeks, even if you don't treat them. But and then they tell me, I say, let you not treat them because all man get in different body, and it's important for making say if you begin sick, now for go. Not take and say, my body well, I go take Bangba, Sekou Touré, or whatever. You go pull them from me. No, doesn't work like that. And if you forget the specific treatment, it go definitely better for you for go. So go for them, and that's that. Other than that, you just unblock yourself and you risk your life. So as I say, this tecovirimat, when the treatment when they use the antiviral, then they bring Sedofovir, where they call Tembexa. Instead, they can use them. But then again, as I said, now supportive treatment. And the vaccine now for that one day as well. So important for me to tell people and say, everybody there at risk, including we in particular, now we there at risk. We the healthcare workers, them now we there at risk. So important for we self for take care. So where they go, we absolutely get PPE, the protection equipment, we get the mask, we get the glasses, we get the gloves, we get the long gown where they protect you. So when you go there, you go inside you help the patient do what you get do for them. Now then you come out and pull this gown, put them in a place, then you go now for them and go able for get you sorted. So then get the donning place and then get the doffing place. That's what they call it. Usai they wear and usai they go pull close. And then of course then try for able for sort that out for you. But the important for remember say people that we get sometimes 4 or 5 partner them and we get multiple partner them, then they're more at risk because you don't know which one don't go to that one day, which one don't go here, those one don't travel, we don't go catch and we don't know yourself don't go catch. So it's important for we maintain that monogamy, that we call them, like they one man, one wife, or one wife, one man, you know, or in the case of the man to man or woman to woman, then get this thing where they can give, we then call PrEP. So before you contract the illness, the sick, they can do that. So now pre-exposure prophylaxis, then call them. Then they then get vaccine where they can give for that kind of thing. It's recommended for people away now, high-risk people, especially when the outbreak day, they can always tell you for them. Like how Dr. Turevin, they say, then get the place in Greater Manchester. If you phone them and tell them with your background, say you're a high-risk patient or high-risk individual, then go take you through, then do all the other testing, and then obviously then go give you the treatment or the prophylaxis that now for try for prevent the sick. People in way they work as sex worker, then say they're at high risk. People in way get HIV, then say they're at high risk. So in fact, what they do when they know say this person get HIV, then they initiate the treatment of the Mpox within 7 days of the diagnosis of the person with HIV, because most of the time then two things they go hand in hand. So I go hand now. So we Miss Nafisa Tusumare, they work for public health, and he will take you through the public health management of Mpox. Thank you so much, Ms. Nafi.
Thank you, Dr. Kamara, and thank you everybody for joining. So as another hearing from Dr. Kamara, and me, they can talk about the public health management of Mpox. My name is Nafisa Tusumare. People can call me Nafi. I mean, I lost my background, but I don't work in public health now for the past 11 years. So I can tell now what we can do in terms of the public health management. Next slide, please. So first of all, Mpox is a notifiable disease. Any country gets in public health department who say health professionals, doctors, where they diagnose or suspect infectious disease, when notifiable, they tell the public health department. So Mpox are one of the diseases that when a notifiable disease. So it just means that if you suspect them or you confirm them, you know, you wait till you confirm them. Even with suspicion, you notify them to the public health department. So what in the public health department they do, they go do the risk assessment. When inside it, then go identify, contact them, and then give advice to the contact them for prevent further spread of the disease. Because in public health, you know, the main focus now for actually identify source and prevent further spread of the source of the disease. Sorry. So specifically for Mpox, what we can do, once they don't notify them to the public health department do the risk assessment to identify close contact of this individual, or the people that will get the disease. And then we can also refer them for vaccination. Dr. Kamara mentioned vaccination, pre-exposure vaccination, but you also get post-exposure vaccination as well for people that we don't become close contact of a confirmed case or suspected case of Mpox. We can offer them or refer them for vaccination at the clinic in London. The vaccination usually we can get like if the exposure day within 4 days, we can actually refer the person for vaccination. But after 4 days, we not can refer after the 4 days. Although I think it can still get as pre-exposure, you know. But within 4 days of the vaccination, if you're not possible not been already get the vaccination as pre-exposure, within 4 days of the exposure, we can refer you for vaccination. So how will they categorize the contact then? We get something called exposure risk. The contact then, we categorize them by different categories. You get category 3, category 2, and category 1. The reason we make a put and so because 3 are the highest category, so I begin with the high one. So how will they determine for say this person they category 3 or category 2 or 1? It depends on the level of exposure we get to the person. We get Mpox. So if you get direct exposure to the person, the cocoa, them, you know, with the working skin, you get direct exposure to that one, or the person body fluid, the fluid where they come up and the cocoa, you get direct exposure to them. Or any material where the person will don't use until close, in the spread, you know, where protective equipment where Dr. Kamara mentioned, we say PPE. You know, wear apron, gloves, you know, wear mask, nothing, you go directly touch the person. You're not a high-risk exposed person, so you go there under category 3. Or if you choke yourself with any sharp way, they don't use by that person, they needle, etc. You go there category 3 because you don't expose to this person body fluid them where you don't use no protection at all. So waiting at the public health advice for person with category 3. You do something called passive monitoring. It means then they advise the person say make you keep an eye on himself. If he develop any of the symptoms that Dr. Kamara don't talk before, the fever, the headache, begin get muscle aches, etc. If for if for stop for work, if you work, you not for go work at all, if for isolating self immediately and access healthcare, which means we'll call NHS 111 and tell them, say, me na contact of somebody who gets monkeypox, Mpox, but now I don't develop symptoms. So then we'll assess the person. While they wait for that assessment, they for make sure say self-isolate until they assess you, and then they give you the advice so they forgive. The public health will also provide information leaflet to this person. We could tell you do's and don'ts, what you for do, what you not for do. Whether for go work or whether you for call NHS 111, you go inside the information leaflet. Even though they will tell you, but they will send the leaflets back to you, so you will be able to get them. They leaflet and they're in different languages. They're in English, they're in Spanish, other languages as well. If I avoid sexual contact or intimate contact, with people, then whilst you don't expose as category 3, because you can develop symptoms anytime from the time we are exposed up to 21 days, you will develop symptoms. So avoid sexual contact or any close contact activity with people. If I avoid contact with people who are at high risk, I think Dr. Kamara mentioned them, people who get weakened immune system, people who are pregnant women, or picking them when they're under the age of 5 for the up to 21 days, for make sure so you go near them people then they. So if your job involve working with them people then they, you're not possible to work with picking them, you're not possible to work with people away, they low immune system, weakened immune system. Sometimes we can advise you say not for go work with them people here. So and then if I avoid international travel, not for the travel between country to country, because you can develop symptoms at any time. Next slide, please. So the category 2 contact, and then at the medium exposure risk contact them. So then are people that we get contact with the person we get, but that intact skin contact you get. So not to say that the cocord, not to say you don't get exposed to the open blisters or whatever. You're exposed to the person but that intact skin, the person's skin they intact, break. The body fluids of the person, any infectious materials we're exposed to, like as I mentioned earlier on, them they spread them close them, etc. If you're exposed to that one day, then passenger they will sit down directly next to Mpox case on a flight. Instead of category 2 exposed person, that they will class them. And no direct contact, but they within 1 meter for at least 15 minutes with the person will get Mpox without wearing protective equipment, no wearing mask at all. Even though you not touch the person, but you did next to them, direct face-to-face contact for 15 minutes. Well, they all go fall under category 2 exposed people then. And the public health advice is more or less similar to the first one. Instead they do passive monitoring, you go just keep an eye on himself. If you develop any of the symptoms of monkeypox, you're supposed to inform call NHS 111 straight away and isolate himself until then doing assessment. Again, we go give them information leaflets, because sometimes we tell person something, sometimes we tend to forget. But if you send them to in writing, if you forget anything, you go back and read. Avoid sexual contact, intimate sexual contact, or any activities where they cause skin-to-skin contact for the next 21 days from the last exposure. Instead, they tell you say no travel international at all. But picking the way exposed, they don't actually advise exclusion from school. Okay, let them go to school. If they develop any symptom, they will exclude straight away. The only difference between this one and the category 3 is then once they not get, like we will say, if you work with high risk people, then you will actually probably not go work with them people that day. When at category 2, you as soon as you develop symptoms, you will actually call 111 straight away and report your symptoms and isolate. Next slide, please. Then we get the category 1, where then are the low exposure category people, then where people that we get contact with the Mpox case in environments where contaminated, but then wear PPE, they wear the full protective equipment, they wear the mask, the apron, gloves, etc. Even though they get contact with the people that wear them, they don't breach no infection control practices at all. Healthcare workers then were involved by the monkeypox in case we don't wear PPE, but they don't get no direct contact. They don't wear the mask and apron, but they don't go near the person, they don't touch them, they don't get no direct contact. And they maintain distance, like a 3-meter distance. They all fall under category 1 and low category people in Nandi. And person will not get no direct contact with the person in equipment them, sometimes touching in bed linens, etc. Then again, we get passenger the way she don't 3 row from the Mpox case under inside plane. So let's say the Mpox case you don't have. If you did 3 rows away from outside the Mpox case you don't, they all fall under low category of exposed people then. We not get public health advice for them in terms of, say, not for go work in case you work with high risk people then, because they don't actually meet the high risk contact definition. Like what's it, then they do don't put what we don't talk about. So then can go about the business normal. But again, if they develop symptoms, they will actually report them. But because then a low category people, then will not actually they tell them say like a monitor yourself and do all this, etc., etc. So there's no public health waiting for them. They can go about the usual business. Then I don't put a link there with WHO self. They actually give public health advice M-POX. So if you click that link, they get a lot of information about how to isolate now. Also, Dr. Kamara already mentioned some of the things that WHO talk, not for use utensils, not for use the same spoon and cup with person we get more M-POX, etc. So that's all for me for this evening. Thank you. Back to you, Dr. Kamara.
Thank you so much. That was really succinct and well presented. All right. So now we talk about self-care and prevention. How would they care for people? And I say we don't talk about this already. We don't go into that. So waiting for do and waiting not for do. Contact your healthcare worker. So dial 111 or 999 or whatever. If you get for stay home like how you do. I've been doing for COVID. Maybe open the window small so that at least the natural air going to come in and out. Remember, nothing the way beat for wash your hands with warm water and soap. There's nothing else. It no matter how some bug the day, no matter how you put that sanitizer on your hand, believe me, you're not going to take care of them. So you get for wash the hands and as often as possible with the soap, warm water, and then after that now you go use the sanitizer, especially for people and we get for touch them wound and then they look good after the wound. Definitely. Remember, wear your mask, cover the crocro outside the lesion, then they, until the crocro well, and then take it from there. If you did in a room, you one grain, nobody else no come, of course you can open that and things, or for lanes if they dry, and but as long as somebody can cover them, so that way then go avoid touching outside the place the way then touch and all that. Now if they touch, obviously nice for ladies disinfect the area then they as often as possible. And you say use salt water, now the mud for rinse, the mud they make them heal better because the salt they attack the wound or the sore foot and then they can make it heal quicker. Warm bath. So the water, if you warm, you let on you put baking powder, baking soda, and then that Andrew's liver salt outside the wound and then itself can help for make the wound them heal quicker. And then you can take paracetamol and ibuprofen for help with the pain and the temperature. But please, whatever you do ya no boss them crocodile them blistered in there or begin scratch them. If you boss it go take time for heal. At the same time, it go scratch, it go pass and begin spread to other part of the body. That's not the problem because the water, the discharge they come out, it go in other part of the body. So it's like they infect yourself. Now that make it fine for avoid that. If you they shave, then avoid the shaving. At least for the 3 weeks where you go there until that's in the well, then you go shave later on. No problem with that. But as long as that's in there, they discharge water or tough or whatever, now you continue for crash arm or continue for pop arm, when that people can do, you just they cause more problem for you because the thing they go through the cycle again. That's not the thing way important. Now this brings me to the most important bit we make with people need to talk about sick, they need to seek medical help and all that, which they call stigma and discrimination. Now that we need for stop. I get people and we obviously been one for talk about the sick and all that, but because of the stigma, because of the things, this one, so you do, and that now my business, now all my business, you go do now, make it this and that, then they're afraid now for come out. And if you're afraid for come out, you're afraid for telling people the way they're not host with. In that way, it expose them, it put them more at risk. So when you put stigma upon something, because you begin to attach that, say, that this, that's what you do, now this, that, that, the next thing we realize is this person, they hide in sick, they hide the symptoms them. I know go straight away, now the place where you need for go. The next thing you realize, other people them will catch up. So please, what you need for do, now for educate with people them, now for raise their awareness, make them know, this is not a thing for shame. I think we can catch anybody. And so therefore important for make we know say, the more we come together, the more we know say this thing, we're all in it together, because when the virus comes, you can travel. Now you go catch up. You can go help person. You they work as a medical person. You go catch up. Not to pass, you go there, go sleep with other man or sleep with other woman or this and that. No, it can happen to anybody. We were there at risk, as we say. Until woman they get belly, until somebody they take treatment and all of that. So nice for now they begin point finger about this and that, because like that make the thing they get worse and worse and worse. But if we educate ourselves, and then of course we correct all the negative language, we go get better, and then we will prevent this virus for spread. Yeah. So this I just make a show now. The one day when I'm medic now, sometimes they go tell me what this thing look like. But when you look at him, this man, a 45-year-old patient, he gets HIV, and then when you get HIV, then can use this test, this blood test, to find out how the person day, how the HIV day, whether they under control or not they under control. When they do them, they call it CD4 count. Now 140 ion come out as. Normally, we can say anything above 200 is okay, but ion day low. And then he come to the hospital to he get this leg way, the ambogam, he swell, and he get pain panam, and he get this crocro. Now, we been get for consult the skin specialist to make you tell you what this thing. Now, if you look at him, you go feel say this man, I don't want to waste time because we don't day long. This man, if you look at him, you go feel say M-POX you get. But believe you me, because he get the HIV, sarcoma, cancer, down there of the skin, so they call him Kaposi sarcoma. Now this man gets so. So if you look at like our doctor today, they say this now other differential diagnosis. Now make you see, then they check the person. If he gets the M-POX, if you like diagnosis, they can always check him for HIV, because then two things can go hand in hand. Plus the other STD. But if you see him, look at him, you go see around here, you go see the normal skin. Look at Naya. The normal skin that when you look at this, you can see the one way done the heal, but the scab already. But this, look at that, alive, even the crutch arm, and then you see the bleeding. All this dark skin now, because of the treatment we've been there, and I make it dark so. Like they say, the skin bruise, bleeding this. The normal skin now in this. Wait till you get now then called Kaposi sarcoma. That now normal thing you go get with HIV. But just to show now. So for finalize, this now the thing that we would do if you come to me now. When person come, he tell me, say, I don't come out in a social country, come home. Within 21 days, I come out from Central Africa, West Africa, or wherever. Within 21 days, when I come, I don't really feel me hate the heart, they feel emotion, then they ask me joint, then they heart, and all that. They feel feverish and all that. Or they tell you, say, this person, like how we say, GBMSM. I don't talk about a gay person, a bisexual person, and then a man who they sleep with the gumpy man. I make them give them the GBMSM. If you get that, the temperature high, they feel this pain, back pain, the swelling at the groin and at the armpit, then obviously they'll go for take you in a side room, then go for go treat you, then do all the things, for so that the thing this is what they use as a check card and call an action card for we own department. So we get guidance from the infectious diseases department, or make we carry on with this thing, how for do how go take this swab, and how go carry on whether the person for dinner or we'll get for need for admit them and transfer to the hospital. That's all in this. And there's a number here, we done the way in the UK, this number, yeah. So they call it imported fever service, now the number than the 0844 number. And then 9, some people can call, let them, as Aja Nafi say, notifiable illness, that thing where person get whether it confirm or you know confirm or we for report to the big O's. Then for actually take this thing on board, then give you advice, they assess which we tell them, and then give you advice as to which thing we need for do and how for proceed. And then we talk to the infectious diseases department, and then we say, well, okay, now so for do, now so for bring this person in, or not for bring her, make it go home, go wait for 21 days, let the keeping high on all the other things. So that's what this is about. And as I say, very important for all the departments to forget this. So we stop so far. We tell you thank you for what you do, come, can listen to. We hope so you enjoy, you benefit from that. And this is my references. So I go stop so far, and we will take questions then. Thank you so much.
No, I make it stop, you know.
I never stop.
Oh, I will enjoy.
Oh, that's good.
Why you stop it? Thank you so much. Thank you very much, Auntie Nafi and Dr. Toure. On plenty, thank you. I believe say how I enjoy them, I believe that's what people enjoy them as well. If I'm going to they say before, is that the opportunity this way when I get for ask any questions or even give feedback if I like them. But ideally we want to ask questions because I believe CS they don't touch on a lot of areas them and maybe address some of the concerns they want to be get. But I believe say still there must be questions in the way una feel say una need for ask. Okay. So the floor open. When they've been do the practice run, I don't learn a lot from waiting they say. We've been on this topic before, but Italics say they don't go read more, they don't learn more, and they don't make them more interesting. That the way been there in the previous one, I said go test say this one kind of more detail, and also we're able to see them from other discipline. When I say other discipline, from other medical people, their own perspective, not just from one person. Dr. Kamara, a senior consultant, yes, he will give things based on in your own experience, but also when you look at them from Dr. Ture in your own perspective, we in a general practitioner, also you don't work in a salon, so you understand the dynamics, how we community in a salon. Then again, in Afina, we don't look as well from a public health perspective. We not them, like maybe they explain that they more can come out with the information as to the the breakdown version for we way not to medical people and for low understand because then doctor are waiting ready for talk. Yeah, good all use that in English ways you don't remember now whether if you worry about the English or if you worry about the sickness. But until I feel the type like the brand come in that level we will make we understand at least put my mind at rest. Okay. So any question I get, feel free for ask. Let us something where you know sure about, say maybe something we can call myth. Back home, I don't know what the word for you. Then say, then say that's something that then say this are your opportunity for you able ask, you clarify, but not just for yourself. If any question where you ask, not you know more the benefits because of where they get them recording. Other people them in the audience or other people them where they watch them online, they self go benefit from that. Okay. Right. We'll not get we get Dr. Bell today.
No, Dr. Bell, busy.
Okay. And also you touch on the pregnancy. Yes, sir. Mr. Ahmad, I can't to you first before I ask me. Yeah, if you press, I don't ask you for on mute. Yes, sir. How are you, sir?
I tell Papa God, thank you.
Perfect.
Right now, I didn't in Canada now.
Oh, wow.
In Canada, where they listen now. I really appreciate the clarification, the stigma people they not get. Apart from the M-POX, present in Australia, people then afraid for go even see doctor because of the charges. But I will say with this clarification, it will make people then get the courage for go see doctors now with the attention. I thank Dr. Kamara, of course, me and Sabi, because I've been the upper ICC number 10. So I've been come to the bar, they interact. But from time now, we go, we know they see again, we know they talk. So this now I really glad because people then go get the understanding. They know now the approach, how to do. Then the stigma, it will reduce by most people then. So I really appreciate my effort. By God power, we will try for the listen to now. And we say we're able to educate other people there now. So thank you so much for the program.
Thank you very much. I'm glad you say well, but you don't make it able to catch Dr. Kamara. You know get anything we text, get an hour, you just attend the program no more, you will see.
Okay.
Thank you very much, sir. And thank you very much for appreciate what they do. And last see somebody put something like text. I'll just see, have a look. I'll see if that question. Okay. You see, my question is, what is the proportion of infection between males and females? We get that information there as to the proportion of male and female. Is it peak by sex? Or one sex they way higher? And if we higher, why? Is there any reason why?
I'm not sure there is an obvious statistical distinction between the man and the woman. I think the man because they say gay, bisexual, man with they sleep with the company man, them that the most at risk group than they. Now whether the woman they're more at risk than the man them is very difficult for us. I can say probably the woman then they're more at risk because we can do the pregnant one them, yeah. That's another category we will have to think about, you know. But I don't think say me not get that statistical figure there for say yes, man them more or woman them. But when you consider the subgroup them, I think say you go agree say something the woman them more than the man them, you know. But that's because they get for breastfeed, then they become pregnant and all that. So always done in a larger figure compared to. Let me just rationalize about that. But it may well mean that the population and that we not gay, we not man to man and woman to woman, probably not equal. But we go look at that, and if you need to, we go send the figure out.
When you talk about pregnant women, so I know see you touch on in your presentation. If we find Dr. Bell for be there as well for like chipping on this. I know see as women marking sick, bikini self can day at risk, but how much risk we Bella woman go get if you get Mpox? Number one, two, for Kamara way the feed, how much risk as well the bikini go there if you get Mpox?
Well, I mean, the risk is such that when the mammy they born, and then they call that vertical, if you like, transmission. When of course blood the place open like a wound or something, that's so you actually contract that one. That's for sure. And then of course you breastfeed, and then it became latch onto the nipple, you can break the nipple, and then one thing go to the other, especially if it didn't at the mouth, you know, and at the nipple they touch, then that can. And so even the herpes. I know say there's cases then don't the way through that breastfeeding then the transmission take place. So that could be a case as well. But within the percentage, as I say, how much of a risk is difficult for let tell you an exact figure or percentage because not to me on side that one they are more epidemiologists than they do with that, you know. I don't know if they don't quantify that, but all I can tell you is a distinct possibility of that happening, especially when the woman they in labor. With the born Pekin. And of course, you know, if the Pekin premature, obviously they're more at risk. If the Pekin die in the belly, stillbirth, they're more at risk as well.
Okay.
And then of course, sorry, the Mpox itself, they pose a very high risk of miscarriage, as it were. Yes. And I one thing that the way we know say it can cause miscarriage. Definitely higher than even for B if at all 19 they not been there around. So that's the other thing. Yeah.
No able know why it will cause miscarriage?
Well, as I say again, possibly in a reaction from the baby we get for do with the blood you know, because now through the placenta and through the umbilical cord, anything that happens. So as I say, when mama sick, picking sick. And so obviously if the mommy get time, it's possible to then go infect the person to the point where he causes problem. You know, to the point where he says until you go miscarry or you go get within a call abortion and things like that.
Wow, it's serious. Yes. Somebody asked a question, say, if somebody be don't get Mpox before, it's possible say we'll get them back.
Well, I just tell you the word say if you crash that crocodile boss, you just extend this thing. Now, I don't think say they don't get a study. We don't tell you say if you don't get Mpox. You could get a certain immunity. Yes, I agree. But without the vaccine, it will be extremely difficult for somebody to tell you, say, you know, go catch them back. Sometimes if you catch them back with the vaccine, when at the smallpox one, the form will be milder. You see what I mean? But it don't go stop you for catching. Remember, the vaccine, na preventative measure, not a curative measure.
Yes.
And this thing, a virus, it can catch anybody, as I say, including we where they work with the people there. So everybody there at risk.
Yeah. And then they in a sort of way, a good way to stress on as well, as in the use of vaccine, because sometimes some of we, I don't say people, some of we can think say, we don't take vaccine, we don't immune that, you know, in order for catching, like preventative, not to something way. Yes, I'll go to Anne.
Hello, Dr. Kamara. Thank you very much. That was excellent. Dr. Ture and the other young lady. It was brilliant. What I want to ask Dr. Kamara is, in the presentation, you said that, like in the health thing, that children didn't have to stay away from school. Is that because they don't get it as bad as adults?
I think Nafi would probably be better placed as to why, if they are category 2, because you have category 3, and category 2 and category 1, and category 2 would not necessarily need to be excluded from school because of certain reasons. A bit like, I don't know whether it's been confirmed or maybe deeply or detailed in a detailed fashion has been investigated or researched. Remember, this thing just started 2 years ago. Maybe they're still in the throes of being researched. However, we had a similar situation with COVID where we thought the children were less of vectors. Yeah, and then we found out, well, I tell you what, they sail through it, but they are also the ones to spread it because they cope with it better, and then they spread it worse than the adults, as it were. So whether that applies to that or not, I'm not sure, but I think somebody in the public health will be able to probably answer that in a better fashion. So over to you.
Perfect.
Thank you.
I think I've been there already, so.
Thank you for your question. And yeah, so I did say that as part of my public health management, that children are not we're not advised to exclude from school when they are category 2. It's because they are the medium category, and not only children, even if you, I don't know if you looked at it properly, and even for the adults, we didn't advise exclusion for even for adults in category 2, because it's actually not as high category as the category 3. We do advise, though, if they develop any symptom, they need to actually exclude immediately as soon as they develop any of the symptoms, not all of them. Yeah, so even adults, the same applies for them. They are not excluded from school, from work. The category 3 is actually the highest risk, where we actually do not advise people who work with vulnerable individuals, like pregnant women, unvaccinated, people with weakened immune system, and pregnant women and children under the age of 5. So those people, actually, we advise exclusion for them, not to have contact with them. But yeah, for category 2, medium risk people, we don't advise exclusion unless they have symptoms.
Yeah. The thing is as well, what happens if, you know, a child goes to school, hasn't got the symptoms, but then all of a sudden takes ill? What happens then?
Say again, sorry, I didn't get that.
You know, like say a child goes to school.
Yeah.
And obviously they've got it, but they don't realise they've got the M-POX. What happens then when they take poorly at school?
Oh yes, when they will ask their parent to collect them from school, obviously. The moment the school suspects that they've got Mpox, because the school, we don't expect school to diagnose a child, but we do expect them if they suspect that the child has got infection, and is actually consistent with Mpox symptoms. They should immediately call their parent to collect them from school. And then they'll go in public health and say there has been a child who's come to school and has developed symptoms that we suspect might be more Mpox. We would then give advice around what they need to do in terms of contact tracing for the other children or staff members who might have been in contact with that child. But we'd wait until they diagnose the child, like somebody who is a GP or diagnose the child and then say, yes, it is. Yeah. Then we would take it from there. But then that child is supposed to immediately leave school. As soon as they suspect it, they should let the parents should collect them immediately.
Oh, thank you very much. That was brilliant.
Brilliant. But thank you very much. Thank you. Yes. And I'm not going to, somebody don't ask that the chat say, what about if he gets Mpox? How if we're able to isolate, what if we do for isolating himself from the family? What are the advice we give of how we be able to protect his family?
Yeah, that's a very good question. That's a very good question. When somebody gets Mpox, depending on if you're not too poorly, you know, require hospital admission, then they advise them for isolating on a house. And when inside the host, I go prevent from for letting you not get in family, not get I forget. If it's possible, let get in your room, and not the best thing. So let inside your room, and not for share utensils with any of in family members there within at the host, as Dr. Kamara be no mentioned and the earlier, so not for share utensils. But try for isolate from them, you know, keep them in your room. But something like it difficult, you know, like then settings the way people in plenty, it can really difficult. But actually, in fact, the link where I put for me public health advice was if you click within WHO say, and one of the things that we talk how person they isolate at home, waiting for do for prevent them. Again, you don't forget sexual contact. Now the host day, if you get your man or your wife or partner for avoid sexual contact with the person, because obviously the past close contact, you know, during sexual contact, you must touch skin to skin touch will happen. So if I avoid sexual contact, you know, for share utensils for the inside your room, you know, if possible for the inside your room. That's not the ways the way you go avoid for the not passing within the family.
Okay, for the
For
benefit,
mask, you know,
thank you very much. For the benefit of the person we ask and everybody else, maybe someone joined late. This now be the slide we Dr. Kamara talk to, and I be don't show now the one we auntie now been talk to as well. Then slide there, if people they want time, please request and we go share. I'm happy for convert them to PDF and share. Okay, and also the one who joined late, the recording go there on YouTube and Facebook. So if I want within a couple of hours, I will upload them, and when I will get them for view. Okay. Yeah, Mr. Brima Bangura.
Yeah, well, good evening. Fine, thank you. I thank Dr. Kamara and Dr. Toure who don't give this presentation. My question I want to ask is that if, for instance, I go to a place where we say people that don't get this M-POX, where or certainly a doctor or anyone, but I don't take the vaccine. What is the probability or the probability for saying me go get them, although I don't take the vaccine?
I think so. We don't answer this question, but anyway, as I say, the vaccine need to stop you for contract the sick. Yeah, wait till they help you. Now, if you contract the sick, you could probably get the mild form rather than the severe form, and that the vaccine they do. So the vaccine now more like a preventative rather than a curative aspect of the treatment or management of any sick. Like, for example, when the COVID comes, some man made the mistake say, when you don't take the vaccine, I go catch COVID 2 times after the vaccine. Well, the vaccine, what you do for you, wait until you never understand, is that when you catch the sick after the vaccine, the way it affects you is milder compared to if you not been take the vaccine, will be for be so bad that you get to go onto the ventilator when you go put that machine for breathe for you. So the vaccine, they prevent you from get the severest form of the COVID that you go end up on ventilator. So in effect, you go get them, but your body they strong enough for attack them and make it be mild rather than severe. The same applies to this one. So I don't know if I didn't make any sense, but that's the analogy I had to make.
Yeah. I don't get it. It's fine.
Yeah? Thank you very much.
You're on mute.
Yes, so I've been not putting me on before self-Anna asking question. I want to talk something about vaccine, and I want to see this man, Gabriel, I ask. Gabriel don't ask about vaccine. Thank you. Just like waiting Dr. Kamara talk, exactly. But I want to add one thing for the post-exposure vaccination what I talk about. Dr. Kamara talk about pre-exposure, when are the best thing for do vaccinate before you expose, especially healthcare workers and 4 days. But the pre-exposure, I talk something about 4 days. I don't know if you remember what I talk, if you did within 4 days of the exposure. Now they tell the refer them. That now one thing where they should say pre-exposure and the best vaccination for give, even though you know the 100% protect you. Because once you don't already expose, I don't know if Dr. Kamara talk on a slide, I think he talk on the rash they develop between 1 to 5 days from where you don't get all this, where you don't begin. So the vaccination, we know the gear where you don't pass 4 days. Because the reason for get the vaccine for stop you for letting you get the symptoms. And even if you get it sick, for let make mild, let get mild form. So, but the main one for say, if you see the post-exposure dates don't pass 5 days, 4 days, we not even refer you again because the reason because you can develop the rash anytime from that end. Yes, so I agree with what Dr. Kamara talking. You know, the 100% protect you. They get some amount of protection. I don't remember on top of my head right now. And I think say the post-exposure, why just give you 20% protection safe. Now I know we will give you if you give you within the 4 days where you take out. That's all I wanted to add. Thank you.
Thank you so much, my family. Every good thing must come to an end. Now one question I want to ask, I'm make a quick and short for me. If I don't touch on them already, that's fine. What I want to ask more, this Mpox, it targets a certain ethnic group or another peak? And two, climate get anything for play with them, for do with them? For example, say maybe hotter climate, people when they get a day more maybe than colder one, or not nobody's.
Well, I know, as I say, you get what we call accessibility, you get availability and affordability. All the 3 8 and they in fact some man saying now 4 A's. Now some man go tell you say it's not prevalent in our country. We don't get that much because we don't get much of people away in a man where they sleep it in company man. All right. But again, with the stigma attached to them, it make it difficult for know the exact percentage of the people in way they will not get the symptom but they get the sick. I don't know if that makes sense. So that's where the danger lies. So if you get the access for let they actually find out when they're sick, or like where you get, for example, hepatitis. We all the hepatitis, but we know waiting at the infection rate we will get in salon. So man they say 9%, so man they say 15%, and all of that. And until we get the exact amount, we can't say. So I can't tell you say black man will be more at risk than white man. The key thing here is everybody, whether it be black, mulatto, or mixed race, or white, if you're a high-risk patient or person, you possibly say you go get them. Climate, I'm not sure whether that they get any impact on how this thing they go on. But I know say in Congo, this thing obviously more so, and it did in that place they most of the time. Now, whether that climate or not, or whatever, I don't know. I can only tell you, say, that area they sometimes you wouldn't live their life and things, that they this thinking there most of the time. Again, it could be amongst the animal them, as you see, arata, squirrel, and the other one them. Then they go around, on themselves, nothing until this person go interfere with them, and then you bring them out, and then of course from human to human and take it from there. So that's where I can say sometimes something else go deep and the epidemiology way, sometimes the public health, or even Dr. Ture sometimes go put on. But that's what I think. So it don't necessarily mean say because you're black you're more at risk. No. All I know is that if you na possibly na man they sleep with your company man, you definitely they more at risk. If you get HIV, you're there at risk. If you get Bele, you're there at risk. If you get cancer, and then you get treatment, you're more at risk. There's no questions about that.
Yeah. Mr. Brahma, you go be the last question. Be I'm trying to make it short because we really don't pass time. I'm not going to keep people too long. Yes, sir.
Now one explanation I don't get. Where Dr. Ture being the president. If you go explain me that one, because you know why? Because I do help something. I want get more of that explanation. Explain, but I not really catch what you be explain for. Say when you get this sickness, he enter through the nerves, then he go fishy don't, but he go. I mean, he enter through the nerves. Then he talk about something we call shinkula. You understand? So I don't really understand. Actually, if you're able to explain that for me back, I will be grateful.
All right. Okay.
All right.
Yeah.
Okay. Yeah. So thank you, Mr. Bangura.
Yeah.
So they try for explain on that side now about chicken pox.
Yeah. Okay.
Once you get chicken pox when young, you get the varicella zoster virus, where now they come, and with time, when you don't go through the chicken pox, they build up some kind of they cure it, they build up some kind of immunity from them. However, the chicken pox need to go completely.
Okay.
Anybody will get chicken pox so it's small in a day, and outside it is store. It is stored at the nerves them.
Oh.
Any people don't get away young. When old people are now, when one either immunity, either pregnancy or age or anything, it build up that chicken pox, they'll be there at the nerves, they come up back.
Oh.
Now, the tan leg, how it be there before where they spread from, all head to toe. Now, once nerve outside be don't store, now they develop. So I one picture when like happy zoster ophthalmicus where affect one picking when the ophthalmic nerve now involved. So now the the nerves with the thoracic nerve, then they happen. So when people then see that important thing and they happen, then they see and they, oh, this was something yeah, like that. They say, oh, this was unsure, whatever. And then they say. So now things then they basically where they happen. So it can go, it can come back. So yeah, they can get an medication for that and get symptomatic treatment, for them. Right. Yeah, Dandy. I hope say Dandy clear now. Then the question
very much.
Yeah, the question we asked about the pox protection. It's about 85%. Within the 4 days of the post exposure. Within Kingi the Huawei and Afibi they talk, you get 85% protection. However, for healthcare workers, they can actually give them a second dose. Normally can be 2 to 3 months after the first one because they are actually high risk. And like how Dr. Kamara explained, whatever vaccine you take, don't mean say you fully covered. You get for protect yourself, which whatever person where they go see, or let get the full blown infection. We go hit you down.
Thank you very much.
You're welcome.
Thank you very much, Mr. Brahma. If I'm Bulem, plenty, thank you. Dr. Kamara be say affordability. Wait else again?
Availability, accessibility.
And now joinability, we can't finish ability. So me people, me family on plenty, thank you. I can go around the panel.
Before you go, TM, I just want to acknowledge, I don't know if he's still there with me. Very big personality, the Deputy Minister of Health been there with me, and he gave a comment where we say, yeah, so shout out to him, and to now all the audience members, we now don't left, we now work today, we now don't come and join we hope so we now enjoy ourselves, and of course, if we now enjoy, we now benefit from Abdia, we now pass the word, so that, well, body, past gentry, will be something way, will be available to the all of the people in the salon, and that we pray for. Thank you.
Thank you very much, Dr. Kamara. Yes, Dr. Charles still there with me. I see him. So I will go first to you, Auntie Nafi, then Dr. Toure, then Dr. Rashid. I've been seeing Dr. Angela been there with you as well. So I'll go around the table quickly. I'll make it short because we really don't go over time. So Auntie Nafi?
Yeah, thank you. TJ. I just want to tell Fambul and thank you for really spared and precious time for joining this session and listening to it. I think that this session really informative. Really to add to that, I hope see people that will listen when I don't find it useful and helpful and when I don't learn from them. And when I not forget say was gently. Thank you.
Thank you very much, Auntie Nafi. Dr. Toure?
Okay, thank you for when I joined. Please, this they go on YouTube, so if you share and to your WhatsApp group or to anybody, let you go learn from them. And we know this where we country not far from wait to talk so if somebody get lump and get for contact the authorities in a salon. I'm sure there is a rapid response group. I believe maybe Dr. Senesi go highlight on Monday, but I think they will go help and give sensitization to the public. So if this presentation self then take and go play on any of the television station or the radio station then a salon, it's not a form of sensitization to the public again. If they want to follow, we do anything, we're more than happy to do so. We tell you all, thank you for joining we. Until we meet again, well, body better pass gently.
Thank you very much, Dr. Toure. Dr. Rashid? Long and short, please.
Pambuda, good evening. Thank you for coming and plenty thank you to Dr. Kamara, Dr. Toure, and Ms. Nafisa too for the wonderful work. I'm particularly glad because I think we did try for catch up with current events, and this thing just the kind of boil at the background, and if people then don't come talk about them, I think say we for appreciate that and also help for scatter the message. When I thank you for come, well body better pass gentry.
Thank you very much, Dr. Rashid. Isata? Isaac Afula. Auntie Okay.
Yeah. Thank Mr. John Fuller. Good evening.
How are you?
Yes. I just want to say thank you to everybody, Dr. Kamara, the presenters, them anyway, and the people that we come. And they'll just remember say no more well body better pass gently and all them things so they get to be able for pass on to other people them and they'll be able for sensitize people them more and pass on the whole world without salon people and they anybody they listen ways to understand KRIO, the sort of learning self get the benefits. Thank you very much.
Thank you very much. Dr. Hansels?
No, he say he join late. He's not going to give comment.
Okay, not a problem. Dr. Kamara, you give the last comment, please. Let us send people and go home.
HRH, though, I don't know if you want to make point from us. I'll tell you no.
I don't see how. Oh.
I don't know, but anyway, no worries. I said I said not say nothing here too. I don't know.
Auntie Doc.
Miss Fuller.
Yes, sir.
How are you?
So good, thank you. Yeah.
Short for people and not send them off.
Yeah. Fumble them now. Good evening. Thank you for joining the program. This program, the reason we make where we choose for talk KRIO for everybody in our country benefit. So DLA we share, invite more people them. The more people then you read them kind of the more then go understand waiting for do where then get them kind of symptoms there. So thank you, Dr. Ture, Dr. Kamara, Janafi. The presentation was brilliant. Thank you so much.
Thank you very much. Uncle Doc, final word, please.
Thank you so much. As I say, I give shout out to Dr. Olabisi Cole, we did with a nice we recognize. I mean, the masjid na Bombay Street, get representatives na my brother, we don't kind today, Mr. Ahmed Amadou, and all the Manchester group, of course, Anne and Iman, Mrs. Binks. We are happy and we're grateful for your support. We all this time with me. So definitely we're grateful. And as I say, they get guided by UNA. So whatever topic UNA face important to UNA, by all means, please forward them and we go look into them and we present them for UNA. Because if I we the cater for person, let you know they're missing out waiting they want. Now they do, So when they guide we go for whose topic then we now significance or importance to them, we will deal with. But as I say, important for them to carry on. So as we know, remember, this life now one know. So if you don't take care of him, well, he will take care of you. And by then he go down too late. But remember, well body, not in a day, we go for Bayam. We know say he better pass gentry. So therefore, keep the spirit going, share the word. Anybody we get for bring contact with or we bring to we for let we forget this thing that the platform for air them to people them. We will really appreciate that. Now that we want. So dear, remember this, well body, better pass gentry, and thank you so much.
Thank you so much. Thank you very much. For anybody who is having me, they know say me na money chuku, but if I spare me time and they make sure say I there, it means say I value everybody. And also if we see people where they come up from different nationalities, where they attend the program, when they talk KRIO, then they come and attend and listen. Here, Lord pass the message to other people. Them Lord try for make them understand what's the benefit of this program. Until we meet again, everybody, better part gently. Good night.
Good night.
Yeah, good night.
Good night, everyone.